whatever's going on is affecting the whole body, not just the brain. And then, perhaps most importantly on the whole thing, was handedness. Now, handedness is not a particularly obvious thing to want to ask about sex offenders. Who cares? I mean, we can imagine, is it left-handed pedophiles, they run the wrong way to escape the police and hit a wall. But what's scientifically important about handedness is there's only one thing that makes handedness: brain structure. It's one hemisphere of the brain versus the other hemisphere of the brain being the dominant one. No one controls that. There was, of course, some history, especially in Catholic schools, of trying to retrain kids to write with their right hand. That happens, but this is in excess of left-handedness. Nobody ever taught anyone to become left-handed. Anyone who is left-handed was born left-handed. Not only were they, we know that they were born left-handed rather than acquiring it early, because fetuses on sonograms have a preference for what thumb they suck still in the womb. And that thumb, of course, in later childhood and then adulthood, is their handedness. The baseline for left-handedness in the population is roughly 10%. Studies vary a little bit, 8 to 12. It's 30% in the pedophiles. The only other group I could find with that elevated a rate of left-handedness outside of gross brain injury are schizophrenics. Something is in the brain, and it was there before birth. There's just no other way to explain this. That doesn't rule out the possibility that there are social or more traditionally psychological contributors. There's no proof that demands that they be there, but there is no psychosocial way to explain height or handedness.